Hello students, good evening. This is Dr. Anil Mahajan from Inspiring Minds. Today we are going to discuss about a very important topic in the anatomy, which is the blood supply of the stomach and celiac trunk, about various branches of celiac trunk. So from today onwards, after this discussion, nobody would ask about this blood supply. Once somebody asks you the question from the stomach or celiac branches, the image should come in your mind. So let's draw the diagram and understand the anatomy. Let's begin. So since from class 11 and class 12 you know a little diagram about the stomach. Here it is. This part designates the fundus part of the stomach. This part designates the greater curvature of the stomach. This part is the lesser curvature of the stomach. Here we can see the first part of the duodenum and second part of the duodenum, and somewhere here belongs to the cardiac part where the esophagus ends. So this is the basic anatomy of the stomach. Now we need to know about the branches of the celiac trunk and mainly the blood supply of the stomach. So let's begin again. So friends, from the abdominal aorta, the major vessel of our body, aorta. From the abdominal aorta, we have celiac trunk. And to supply the stomach, the celiac trunk has the significant role. Celiac trunk has 3 branches. Here somewhere is your celiac trunk, which has 3 branches. Left gastric artery, splenic artery, and common hepatic artery. The left gastric artery of the celiac, the first branch, left gastric artery of the celiac trunk, somewhere supplies the upper part of the lesser curvature. And from the left gastric artery, we have more branches, which are known to be as esophageal branches. Which supplies the lower part of the esophagus. Celiac trunk, the first branch is the left gastric artery, which supplies to the upper part of the lesser curvature of the stomach. The second branch of the celiac trunk is splenic artery. Splenic artery supplies and goes till the hilum of the spleen. Second branch is splenic artery, which goes to the spleen till the hilum of the spleen and supplies to the spleen. But from the splenic artery we have 2 more branches, which is short gastric artery or short gastric branches. Short gastric branches, or you can say the artery. And left gastroepiploic artery. Let us revise till now. For the blood supply of the stomach, we need to know it originates from abdominal aorta. Abdominal aorta has celiac trunk. The celiac trunk has a significant role in supplying the stomach. 3 branches from the celiac trunk. First is left gastric artery, which is supplying the upper part of the lesser curvature. The next is splenic artery, which goes posteriorly from the stomach and goes directly to the spleen till the hilum. And from the splenic artery, we have one more artery, which is the short gastric artery, supplying the fundus. and another is left gastroepiploic artery, which is supplying the upper part of the greater curvature of the stomach. The third branch here we see from the celiac trunk is common hepatic artery. Which one? Common hepatic artery, which goes and supplies to the liver. Common hepatic artery. But before it reaches to the liver, it transforms into hepatic artery proper. Hepatic artery proper. And from the common hepatic artery, we have one more branch, which is anastomosing with the left gastric artery, which is known as right gastric artery. Right gastric artery. So, left gastric artery is anastomosing with the right gastric artery, but left gastric artery arises from celiac trunk. Right gastric artery is the branch of common hepatic artery which is arising from the celiac trunk. We need to keep in mind. Then from the hepatic artery proper, we have one more. From common hepatic artery, we have one more branch, which is gastroduodenal artery, This gastroduodenal artery is supplying to the lower part of the greater curvature of the stomach, and it is anastomosing with left gastroepiploic artery. Not directly, gastroduodenal artery gives one branch, which is right gastroepiploic artery. Right gastroepiploic artery, which is the branch of gastroduodenal artery. The right gastroepiploic artery is anastomosing with the left gastroepiploic artery and supplies to the stomach. And this right gastroepiploic and left gastroepiploic also give supply by gastric branches. Which one? Gastric branches. Left gastric artery also gives gastric branches. This gastroduodenal artery goes posterior side and gives superior pancreatico-duodenal artery. And the superior pancreatico-duodenal artery again has its branches: anterior superior pancreatico-duodenal artery, posterior superior pancreatico-duodenal artery, which is at the last supplying to the pancreas and the duodenum. So let's revise again. So we are studying the blood supply of the stomach. For the blood supply of the stomach, I told you the celiac trunk is the main thing we need to keep in mind. Celiac trunk has direct three branches. First is the left gastric artery. Where it is supplying? Left gastric artery is supplying to the upper part of the lesser curvature of the stomach. Here you can see in the diagram. Keep drawing the diagram all the time if you need to keep in mind the image. Another branch of celiac trunk is splenic artery, which is going till the hilum of the spleen and supplies to spleen. But this splenic artery gives two branches: short gastric artery and left gastroepiploic artery. The short gastric epiploic artery supplying to the fundus, left gastric epiploic artery supplying to the upper part of greater curvature of the stomach. Then another is third branch is common hepatic artery. Which one? Common hepatic artery. The common hepatic artery, we have one branch which is right gastric artery, which is anastomosing with the left gastric artery. Right gastric artery anastomosing with the left gastric artery. The another one which arises from the common hepatic artery, or we can say when the common hepatic artery has to go to the liver to supply, but it transforms into the hepatic artery proper. Sometimes the right gastric artery, we say it is a branch of hepatic artery proper, but most of us, when we are keeping in mind the blood supply of the stomach, we write from the common hepatic artery we have right gastric artery. The another is which is arising from the common hepatic artery is gastroduodenal artery. This gastroduodenal artery has a very has the course from the posterior of the stomach and duodenum. From the posterior of the stomach and duodenum, it comes down and gives right gastroepiploic artery, which is supplying to the lower part of the greater curvature, and it gives one more branch which is superior pancreatico-duodenal artery. Superior pancreatico-duodenal artery has two branches: anterior superior pancreatico-duodenal, posterior superior pancreatico-duodenal. Anterior superior pancreatico-duodenal and posterior superior pancreatico-duodenal. Friends, when another thing you need to keep in mind, when common hepatic artery transforms into the hepatic artery proper, it goes to the liver to the right and supplies to the right lobe of the liver and the left lobe of the liver. From the right lobe of the liver, this one is the right lobe of the liver. Just imagine the right lobe of the liver. If it is supplying from the right lobe of liver, this hepatic artery proper gives one more branch which is known as cystic artery. Which one? Cystic artery, which supplies to the gallbladder. So this is all about the stomach blood supply. So let us revise with the MCQs. If we say which is the first branch to supply the stomach from the celiac trunk, it is left gastric artery. Which is the largest branch of the celiac trunk which supplies to the stomach? It is splenic artery in the form of short gastric artery and left gastroepiploic artery. If we say largest branch, if we say which is supplying more than 20% to the stomach, yes, it is left gastric artery. Keep in mind, to the stomach 25% of the supply is being supplied by left gastric artery. Now, if I ask you individually, according to the anatomy of the stomach, what is the blood supply of the fundus part of the stomach? You will say short gastric artery. What is the blood supply of the lesser curvature of the stomach? You will say upper part is left gastric artery, lower part is right gastric artery, which are anastomosing together. Yes, okay. So today we discussed about the stomach blood supply and the celiac trunk. Celiac trunk is coming from abdominal aorta. Celiac trunk, 3 direct branches. You just need to keep in mind and clear-cut image concept. Whenever somebody asks you the question, the image must come under your mind, and you can't wrong the question. Best of luck. Keep revising. Inspiring minds.